Needles. The phlebotomist must know two critical things for any given blood draw: which kind of needle to use, which kind of tube to use. All needles used by the phlebotomy should be sterile, disposable, used only one time. Inspection of the needle package before use is very important. The phlebotomist must make sure the seal has not been broken. If the seal has been broken, the needle should be properly disposed of in a sharps container and a new needle used. Next, the phlebotomist must inspect the needle itself to make sure that there are no defects that could cause harm to the patient. Features of phlebotomy needles: point, bevel, shaft, lumen, gauge, hub. Features of phlebotomy needles: the point. A sharp needle will have a smooth entry into the skin with the minimum pain to the patient. Bevel, aka angle, eases the needle into the patient's skin and prevent the needle from coring out a plug of tissue. Shaft, body of the needle. Needle shaft come in a variety of lengths. Routine venipuncture needles range in length from 3/4 to 1.5 inches in length. Some phlebotomists prefer longer needles because they are easier to manipulate. Others prefer shorter needles because they ease the fear of their patient. Lumen, the hollow tube within the shaft of the needle. Gauge, the diameter of the lumen. Needle packs are color-coded by gauge for easy identification. The smaller the gauge number, the larger the lumen. The larger the gauge number, the smaller the lumen. Choice of gauge depends on the type of blood collection and the condition of the patient. The largest diameter used routinely in phlebotomy is a 16 gauge needle, typically used by blood banks to collect from donors. The smallest diameter needles used is a 23 gauge needle for collection from patients with small, fragile veins. (20 to 21 gauge needles are used when collecting routine blood samples from adult patients. This must be printed a long time ago, because in my phlebotomy classes say 21 to 22 gauge is what we basically used. So this is one thing. When I get to the book, it's something else. Okay. Hub. The hub is the place where the needle attaches to the collecting tube or gauge or syringe. So now we're going to do types of needles.